We're talking about chocolate and how it may be good medicine for reducing the risk of an irregular heartbeat, says this study. Medical researchers have identified a compound that may reduce the risk of a dangerous a type of heart rhythm that can lead to strokes or dementia or heart failure or even early death. In a study of more than 55,000 Danish men and women, they were tracked for up to 16 years. People who use this compound were 20% less likely to experience the heart condition. And in general, the higher dose had a lower risk involved. So we're wondering about this magic wonder drug that helps folks with their heart. It's chocolate. Researchers led by Elizabeth Mostovsky says the epidemiologist who studies the risk factors of cardiovascular disease at Boston's Beth Israel Deaconess Medical Center weren't the first to look for evidence that chocolate might prevent some of the dangerous heart rhythms called arterial fibrillation. So joining us on ESPN 93.5 this morning is Dr. Robert Edmonson. Good morning, Robert.
Good morning.
I'm learning that chocolate could be good for your heart. Is that true?
Yes, it is true. It can be good for the heart. It's actually been known for some time that chocolate, dark chocolate, has beneficial cardiovascular effects. It's the flavonoids in it that are antioxidants, if that rings a bell, and antioxidants help prevent cardiovascular disease. So it does have some qualities that do that. Fruits have the same compounds in it as do other products that aren't as attractive as chocolate, but chocolate can be a benefit in moderation.
In moderation. And dark chocolate, you said, Robert.
Yes, that's correct.
Very good. Well, and of course, in moderation is the key to all of these health conversations that we're having, it seems. And you at least got a jab in there for fruit and, vegetables, and a healthy lifestyle is always helpful. And in the summer, I feel like we just have so many options to choose from. It's a wonderful time to start to change your bad habits and get on the right track, don't you think?
Oh, absolutely. I love that lead-in because I would love to talk about that. Atrial fibrillation was brought up as an issue, and that's important because it's a very important disease, and for people to know about it. But the principal things that prevent it are controlling blood pressure, lack of obesity, exercise, not having diabetes or reducing it with proper nutrition and diet, the people with sleep apnea. All these are factors that affect atrial fibrillation far more than the benefits of the chocolate, and avoiding saturated fats and trans fats, which damage our cardiovascular system, all promote atrial fibrillation. So yes, and I'm a big promoter of a vegan diet. I think that's very important for our health, and it's not punishment. If you eat properly, you actually feel much better, you think better, and you'll live longer and have a more vigorous life. So all these factors are important, and I appreciate you bringing that point up.
Well, I know Stevie J here, who's typically our host here on ESPN 93.5, is a big sugar buster, and he likes to keep his sugar on a daily dose of 30 grams or less. And boy, that can be hard when you start looking at labels.
Well, yes, but my own view of it is that you should eat the proper foods, high nutrition, low in calories, principally plant-based nutrition, and you don't really have to count anything. You eat the right foods, and it all takes care of itself. So I know it's difficult, and any effort that people make to reduce things which are not beneficial for them is a good thing to do, but if you eat the proper foods, you don't really have to worry about that.
Well, I know that we have the Mettler Center here that can empower you to make nutritional choices that have a healthy lifestyle with their one-on-one coaching with a registered dietitian. Do you recommend that kind of free consultation to actually see where you're at and give some helpful tips?
Oh, I think that's absolutely the right thing to do. No question about it. And, so much of the cardiovascular disease we have, which is our number one killer, it's basically preventable for 90% of the incidents with a proper lifestyle. And coaches, people who understand that, can be a great benefit. I think the principal problem in our country is lack of education. If people realize that this is what these foods are doing to them, what these foods do for them, they'd be much more inclined to eat the right foods if you understood what exercise was doing for you, you'd be much more likely to exercise. If you understood what obesity was doing, you'd be much likely to gain weight. I think that's all excellent information, and I would strongly encourage that.
You know, I was at the movie theater watching Wonder Woman yesterday, and there was a gal who needed in and out a couple of times during the movie, and she was a little on the heavy side, and it got me thinking about, looking around at people, and really it's 6 or 7 out of 10 that are overweight in our community here, and it just seems like we are taking a pass on the fitness and the healthy lifestyle. I guess it's just that we're so busy and we're doing drive-through more, and it's just so much easier and it's cheap. Oh, it's frustrating.
Well, it's frustrating to me, and I have, of course, that to deal with here in Dallas, of course, and it is unfortunate because in the Asian countries before they get McDonald's, they eat crispy plant-based foods. They have tight community, family relationships. They are outside working. They don't have hypertension. They don't have diabetes. They don't have the dementia that we have. All the issues that we're fighting have to do with our lifestyle. And we can have the best of both worlds, and enjoy all the wonderful aspects of being Americans, but adopt the lifestyles that give us better longevity and better fitness and better clarity to do the things that we can enjoy. So I think it's education is a big issue, and a lot of the media, that we see with all the advertisements for all the double beaded cheeseburgers, all that's information which is bad, and we need more education about the things which are good for us.
That's true. Dr. Robert Edmonson, thank you so much for giving us this insight. Again, dark chocolate is where we kind of started, but in moderation. But that led to a looking at what you're eating these days, and plant-based foods is the best choice.
I agree.
So where can we get more information in case somebody wants to reach out to you and have this conversation continue?
Well, I'm with Marula Medicine. That's the Marula tree is the tree of life in Africa. That's not a term that too many people understand, but it's MarulaMedicine.com. You can reach on the internet.
Very good. Thank you, Robert. Have a good day.
Thank you. I appreciate being on your show.
All right. You take care. ESPN 93.